Hi, I'm Kelly McCochran. I'm a nurse practitioner student for Maryville University doing my head to toe exam with my patient Charla, who's a friend of mine. And before she came in, we had her empty her bladder, we got her height and weight, and we did the Snellen chart for the far vision and the Rosenbaum chart for the near vision, and we measured her vitals. And everything was within normal limits. So Charlotte, today I'm going to do your head to toe exam. We're going to start with your head. We're going to work our way down. I'm always going to be inspecting. First I'm going to inspect your facial features, making sure that everything is symmetrical. I don't see any rashes, any bumps, any lumps, or anything out of the ordinary that I'm concerned about. And then I'm just going to palpate your skull, just making sure that it's freely movable. I don't feel any lumps or bumps. I don't feel any areas where there's no hair. Your hair is nice, it's not coarse, it's not breaking off, and I don't notice any alopecia. So then I'm just gonna palpate your facial bones and making sure those are all symmetrical, no lumps, no bumps. And then go ahead and open your mouth for me and close your mouth. I don't feel any pops, clicks, or anything with looking at the TMJ. And then I'm going to go ahead and look at your eyes, make sure that your eyebrows are symmetrical, they are extend the same. Look at your eyelashes, they are going out and up, away from the eye. I don't see any noticeable lumps, bumps, anything like that. I'm going to go ahead and just palpate your sinuses. Any tenderness, anything there?
No.
And then your sinuses, your frontal up here. Any tenderness there?
No.
I'm just gonna press lightly on your eyes. Just looking for anything, any bulges, any edema, anything like that. I'm just gonna look at your lacrimal apparatus and make sure that looks okay. And I don't see any drainage from that. I'm then gonna move on to your ears. And we're gonna do the same thing. I'm going to inspect your ears and making sure that there's nothing, no skin tags, no lumps, no bumps, no rashes. Always looking at the skin, always making sure there's everything that is there is a normal marking. I'm just going to go ahead and palpate your ears, just looking for any lumps or bumps or anything. And then I'll get my otoscope here. Look in your ear, just making sure that your tympanic membrane looks nice and pearly and gray, and it does. I don't see any cerumen. Pulling your ear up and back, making sure that that tympanic membrane looks nice and pearly and gray. And then we're gonna do your fields of gaze too, before I move on again to some more testing for your hearing. I just want to make sure that looks good. So I'm going to have you focus on my pen. We're going to go back and up. And then I'm going to go ahead and have you do the cover and uncover test. I'm going to have you cover one eye, just stare forward, cover one eye. Okay. And then take that hand down, and then put your other hand up, and everything looks good there. I don't see any extraocular movements. I'm going to go ahead and check your pupils and making sure that they're constricting normally, and the concentric of the opposite eye, making sure that it constricts also, and it looks good. I'm then going to go behind you. I'm just going to do what's called a whisper test. So I'm going to go behind you, and I'm going to have you cover one ear.
Purple. Red.
Okay. And then I'm going to go ahead and do the Weber test. Just tell me if you hear it in one ear. Both ears, both ears. Okay. And then I'm going to go ahead and do the Renna test. We're going to put that on the back of your ear. You just tell me when you can't hear it anymore. then I'm gonna put this in front, testing your air conduction, looking at the clock, knowing that it's supposed to be twice as long as the bone conduction.
Okay.
Okay, and then I'm gonna go ahead and test some of your cranial nerves. So I'd like you to wrinkle up your eyebrows, your forehead, close your eyes tight, okay? You can open them, puff out your cheeks, smile, clench your teeth, stick out your tongue, move it from side to side, looks good. Okay, and then I'm gonna have you close your eyes and I'm gonna do some light sensation. You just tell me where it's at, where you feel it.
Left side above the forehead, left cheek, left side of the chin, chin.
Okay.
Right side above my eyebrow, right cheek, and right chin.
Okay, and that is all intact. So then I'm gonna go ahead and I'm gonna grab my pen light and I'm gonna go ahead and move on and assess your nose. I'm just gonna look up your nose, making sure that everything looks pink and moist. The turbinates look good. There's no polyps, any noticeable polyps. Your septum's not deviated. That all looks really well. I'm just gonna have you hold one side of your nose and breathe in and out of the other. And then you can take that down and do the other. Any difficulty there?
Nope.
Okay, and then I'm gonna go ahead and have you open your mouth. And everything's looking good, everything's pink, moist. The tongue looks good. I'm gonna get my tongue depressor so I can move things around here. I'm just gonna hold your tongue down. If you can just say ah for me. And the uvula moves up and down like it should. And then I'm just gonna look in your jaws here. And your teeth look good. There's a couple fillings. No signs of gingivitis or any problems with the gums. Looking at the hard and soft palate, those both look moist and pink. Go ahead and stick your tongue out again. Okay, and I test your gag reflex, it's there. Teeth look really nice and white and well taken care of. Okay. Alright, so we're gonna move on to your neck, and I need my pen light again. So I'm gonna have you just turn that way, just looking for JVD. Turn the other way, looking for some JVD. No JVD is noted. I'm just looking again, inspecting, looking at the skin, making sure there's no lumps, bumps, lesions, anything abnormal, any rashes. And I don't see anything. I'm gonna go ahead and just check your trachea, making sure that that's midline, and it is. I'll go ahead and go behind you and check your thyroid. Okay, and that's good. And then I'm gonna go ahead and just feel your carotid pulses here. And those are 2+, one at a time. And then I'm just gonna do some range of motion exercises. So if you can just bring your head to your shoulder, to your other shoulder, forward, back, and then if you can shrug your shoulders. Okay, now I'm just gonna have you do it again, just against resistance.
Okay.
So, okay, and then forward, and then back, and then shrug your shoulders, and that's good. So I'm gonna go ahead and listen also while I'm here. I'm gonna have you just hold your breath and listen to your carotids with the bell of my stethoscope. And there's no bruise or anything noted there. No bruise, no nothing, that's good. So then I'm just gonna examine your lymph nodes. So I'm just gonna kind of press around on your face and under your chin. We're gonna look at the pre-auricular, the post-auricular, the occipital, And then we'll come forward, we'll see the tonsillar, and then the submandibular, and the submental. And on the sides, we have the superficial and posterior cervical chain. And then we have the deep cervical and the supraclavicular. And then while we're here, I'm just gonna go ahead and check the ones that are underneath here, just making sure I don't feel any nodes. And I don't, so that's good, no lumps, bumps, or anything like that. So then I'm gonna go ahead and look at your arms. Again, inspecting your skin, making sure I don't see any lumps, bumps, any rashes. You're always assessing the skin. I don't see anything there. Okay, the temperature's the same. I'm gonna go ahead and feel your brachial pulse, which is good, and feel your radial pulse in both hands, and then your brachial pulse. And while I'm here, I'm just gonna go ahead and do your reflexes. I'm gonna try to get out of the way of the camera. That's good. There's a little jump there. And then I'll turn that over and do a little there. Okay, everything looks good there. We do need to check your capillary refill. We're making sure that it's less than 3. And that looks good in that hand. And that looks good in that hand. Okay, so then we're gonna move on to your back. So I'm gonna go ahead and have you turn around. And first of all, I'm just gonna kind of look again. Are you okay? Stuck in the gown. We'll just pull up your shirt. We're just looking for any lumps, bumps, any rashes, any problems with the skin. I'm also looking at her respirations to make sure they look even between the front and the back, and that's all symmetrical. She's not using any extra muscles to breathe, so that all looks really well. I'm just gonna go ahead, press up against you and have you say 99.
99, 99, 99.
Okay, and that all feels good. And then I'm just gonna pull your shirt down so you're not sitting there with your shirt up. I'm gonna go ahead and just gonna palpate your back, just making sure you don't have any pain. Any pain?
No.
Okay, and I'm gonna do your costovertebral angle on both sides. Any pain there?
No.
Okay, so I'm just gonna do some percussion on both sides, going from one side to the other. Just listening for anything that doesn't sound normal, like if there's any fluid in the lung, anything like that. If you could raise your arms for me, I'm gonna do both of the lateral sides. And that sounds good. One of the last things I'm gonna do, I'm just gonna have you lean forward and kind of give yourself a hug. And then I'm just gonna check your expansion. I just want to take a big deep breath in and back out. And my hands move symmetrically, my thumbs moved the same. So not one side is pulling from the other. The next thing I'm gonna do is check your diaphragmatic excursion. I'm gonna have you take a deep breath in. Okay, you can breathe. And then I want you to exhale everything out. And hold it. Okay, and then I'm just gonna, I have my little measuring tape, I'm gonna measure that. And it's about 3.5 centimeters, which is normal to be 3 to 5 centimeters. The last thing we're gonna do is I'm going to listen to your lungs on the back side here. Having you take some deep breaths going from side to side. making sure that I don't hear any crackles, any wheezes, any rhonchi, and that it sounds normal on both sides with both lungs, comparing both sides. Okay, I'm just gonna have you raise your arms. I'm gonna compare the lateral sides. Okay. All right. And that all sounds good. Everything was clear throughout. You can turn back around to me and the audience. And then we're basically gonna do the same things on the front of your chest. I'm just gonna kinda palpate around, making sure you don't have any pain in your chest. Anything there? I'm gonna go ahead and have you say 99.
99, 99, 99.
Okay. And then I'm gonna go ahead and do the same thing. I'm gonna just percuss, hopefully not in front of the camera, from side to side, just listening for anything that sounds different. Because you can percuss and hear fluid in the lung, a pneumonia, anything like that. Go ahead and raise your arms for me. I'm gonna percuss on both sides. Do one more over here. And those all sound nice and even and within normal limits. And then I'm gonna go ahead and listen to your lungs. And then if you can go ahead and raise your arms. Big deep breath. Big deep breath. And we'll get one more. Okay, and that's, your lungs are clear to auscultation. So now I'm just gonna listen to your heart. I'm gonna start at the aortic. Then we're gonna move over to the pulmonic. Listening for the S1, S2. I don't hear any murmurs or gallops or anything. Go down to Erb's point. Move down to the tricuspid area.
Should be quick.
And then the mitral area. And everything sounds good. I don't hear any swishing or any like murmurs, anything like that. So I'm also gonna just percuss your chest. I'm just feeling for any lifts or heaves or anything from your heart. And then I'm gonna feel down here. And then I'm just gonna find your apical pulse. Making sure that it's where it's supposed to be, not off to the side, because that could be in the large heart. Okay. So I think we're done with the chest. And then we're gonna go ahead and have you lay back. I'm gonna have you lay back, and then I'm probably gonna come over on this side. I'm just gonna raise up your gown and look at your stomach. Where's my pin light? I'm looking more at your stomach. And then I'm just looking for any pulsations, any heaves, anything like that from your stomach. Everything looks normal. I don't see any scars. I don't see any rashes. I don't see any lumps, any bumps. So I'm gonna listen to your bowel sounds. In all four quadrants. And that all sounds good and within normal limits. And then I'm just gonna listen to your aorta, just listening for any bruise or anything. The right renal artery, the left renal artery. Moving your pants a little. The left iliac, right iliac, left iliac, and then the femoral. And that all sounds good. I don't hear any bruise or anything. So that all sounds good. So then I'm just gonna kind of do the same thing. I'm gonna percuss again. Just kind of listening for any organs. If I hear anything abnormal. And then we also want to just feel for the pulse of the aorta. So I'm just messing with your belly a little bit there. And then the other thing I'm going to do is just percuss up to find the liver borders, and then percuss down to find the size of the liver, and that seems to be in the normal size. And then I'm going to go ahead and we're going to try to percuss the spleen, but in a normal person, the spleen, you can't percuss it. And then I'm going to do some light palpation. So I'm just going to push a little bit. Anything painful, tender? Okay. All right. And then I'm going to get a little bit harder with my palpation. I'm going to try to feel the liver. I'm going to put my hand back here and just try to push in and feel the liver. And it feels normal. And then I'm going to feel the right kidney and the left kidney. And I'll attempt the spleen, but normally, unless it would be enlarged, we wouldn't be able to feel it. So everything looks good with the abdomen. Just kind of lift your, I'm going to see how your muscles pull when you kind of just lift your head up. You lay back down, just kind of lift your head forward. Okay, and they pull normally. Okay, so I'm going to come back around here and have you go ahead and sit up. I'll give you a hand. Give a friend a hand. I'm just going to do some more muscle strength, just a little bit. I'm going to have you put your hands out. And I just want you to push up against me. Pull down. Okay. Nice and strong, 5+. I'm going to go ahead and look at your knees and your feet, looking for any edema. Again, inspecting any lumps, any bumps, anything that shouldn't be there. Making sure the hair's evenly distributed if you have hair on your legs, which you don't. So then I'm going to go ahead and feel your pulses. The popliteal pulse, the pedal pulse, and the tibial. And those are all 2+. This one, popliteal, posttibial, and then the pedal. Then we just have to test your reflexes. If you'll just hang your legs down. I'm gonna clunk your knee a little bit here. That's good. And then I'm gonna bring your foot up, and I'm just gonna kind of rest it against me, and I'm gonna do your Achilles. And there's a little jump there, and a jump there. I just want you to go ahead and bring your legs up. Try to push them down. Okay, try to pull them up. Okay, put your feet on the gas. Okay, and then pull back. Good job. 5+. So I'm just gonna have you stand up, and I'm gonna go ahead and have you turn around. Just want you to bend forward, kind of drop your arms down. Okay, I didn't know you was gonna touch your toes. I'm just looking at your spine, making sure there's no curvature. Is there any pain?
No.
Nope, it all looks good. Okay, so this concludes my head to toe assessment. Thank you very much, Charla. Thank you, Maryville.